A family history of cancer does not automatically mean that biologic medications are unsafe for patients with rheumatoid arthritis. However, the level of concern depends on factors like the number of affected relatives, whether those relatives are first degree, like parents, siblings, or more distant relatives, like grandparents and uncles. The type of cancer. Some cancers have a strong genetic component and require extra caution, like BRCA-related breast and ovarian cancer, for example. So what can we do to minimize any potential risk in rheumatoid arthritis patients with a family history of cancer if they are going to use biologic medications for rheumatoid arthritis? That's what we'll discuss in this video. I'm Dr. Hatim Malayshi, consultant rheumatologist. I also provide online consultations for patients with arthritis. Let's begin. Measures for risk reduction of any possible cancer in rheumatoid arthritis patients with a family history of cancer and who are using or might be using biologic medications for the treatment of rheumatoid arthritis. Number one, although we don't really have a strong reservation against the use of biologic medications here, consider non-biologic medications as the first option still, if possible. And this is what we actually do most of the time in all of our patients anyway. Start with conventional treatments like methotrexate, hydroxychloroquine, which is called Plaquenil, leflunomide, which is called Arava, or sulfasalazine, which is called salazopyrin, at optimal doses and for optimal durations before moving to biologics. Number two, if a biologic medication is necessary, prioritize those with the lowest malignancy association, such as Actemra, Orantia, MabThera, provided that this is feasible. Feasible here means they are good options for your specific condition, they are available and are covered by your insurance. Number three, optimize lifestyle and adjunctive and assistive therapies. Reducing inflammation naturally may help limit the need for strong immunosuppressants. So what do we need to do here? Go for an anti-inflammatory diet rich in omega-3 and antioxidants. Participate in regular exercise and physical therapy if possible. Use vitamin D and other immunosupportive nutrients. Note that we need vitamin D only if we have a deficiency in vitamin D. Otherwise, vitamin D is not a treatment for rheumatoid arthritis. Also, stop smoking if you are a smoker, as this reduces both inflammation and reduces cancer risk and improves your response to immunosuppressants or the treatments of rheumatoid arthritis in general. Number four, modify biologic use when necessary. For patients using biologics that have been questioned for a possible cancer association, consider shorter duration therapy with, of course, periodic reevaluations. And also avoid high-risk drug combinations. Examples are shown on the screen. Avoid TNF inhibitors with azathioprine, especially in young patients, and avoid TNF inhibitors with cyclophosphamide, called endoxan. This combination increases malignancy risk, but it is extremely rare to use this combination, and it's not for RA patients with arthritis, only for patients with lung affection. Number five, go for a regular cancer screening. What you need here is standard screenings, the age and sex screening like mammograms and colonoscopies that are only related to the age and sex of the patient and not to RA or the treatment of RA. Additional targeted screenings will be for at-risk patients, including blood cancers, lymphomas, leukemias, and skin cancer, and also more intensive screening for patients with known genetic cancer predispositions, like BRCA mutations associated with cancer of the ovary or breast. Number six, shared decision-making. We doctors discuss the risk-benefit balance with each patient. Sometimes, in selected cases, we will involve an oncologist or genetic counselor when hereditary cancer risk is high. So, in conclusion, biologic medications are not necessarily contraindicated in patients with a family history of cancer. However, careful treatment selection, lifestyle optimization, and regular screening are essential to minimize risk. I will leave some of the important references for the data in this video in the comments section below. If you have any questions, please drop them in the comments and I will respond to them myself. If you have any questions, please drop them in the comment section and I will respond to them. And if you have specific concerns about your arthritis or need a more in-depth discussion about your treatment options, I offer online consultations where we can talk one-on-one. You'll find the details of how to book an appointment in the description below. I'd be happy to help you navigate your journey to better health.